Sanjay, I just want to remind people what the president was saying earlier in this crisis. He was out there touting hydroxychloroquine as a possible treatment, saying, what have you got to lose? Here's some of the things he said about it.
The FDA also gave emergency authorization for hydroxychloroquine. We're having some very good things happening with it. It's shown very encouraging, very encouraging early results. There are some good signs. You've read the signs, I've read the signs, and I say it. What do you have to lose? I'll say it again. What do you have to lose? Take it. If things don't go as planned, it's not going to kill anybody. It will be wonderful. It'll be so beautiful. It'll be a gift from heaven if it works. If some other person put it forward, they'd say, oh, let's go with it. What do you have to lose? Try it, if you'd like. I've seen things that I sort of like, so what do I know? I'm not a doctor. I'm not a doctor, but I have common sense.
So, this isn't sort of to blame him, although it does sort of show the dangers of any elected leader touting one specific drug that hasn't really been rigorously tested. Talk about this new study, which unfortunately has had very negative results.
Yeah, I think the one thing that we can all agree on, that it would be a gift to have an effective therapy right now. Everybody on the planet certainly wants that, but the evidence has not been very good around hydroxychloroquine. These are early studies. And under any other circumstances, Anderson, we probably wouldn't even be reporting on these studies, but these are not normal circumstances. This was still a relatively small study, as you mentioned at the top of the show. It was not randomized, meaning people weren't randomly put into different groups. It's not peer-reviewed, meaning other scientists haven't independently looked at this data. But it came out of the VA, pretty good study. We can show you the data here. 368 patients, and they were sort of, some patients got hydroxychloroquine, some got a combination of hydroxychloroquine and azithromycin, and some got neither. The patients who got the combination therapy, about 22% of them unfortunately died. Patients who did not get that combination therapy, 11% of them died. If you just got the hydroxychloroquine, it was even worse. 27% died. But again, a small study here, and we need the larger data. There were some 10,000 doses, I believe, initially, Anderson, that went to New York. Those were supposed to be given as part of a clinical trial. I know that some of the data now has been sent over to the FDA for further review. We need to see that data, because that's really going to paint the story. But so far, this VA study, the studies out of Brazil, out of Sweden, and out of France, some of the more recent studies out of France, have not shown this to be an effective medicine, and some of them have shown it to be, with significant side effects, even death, Anderson.
Were the people who were picked to get the hydroxychloroquine in some way sicker than the people who were not?
Well, that's the question. When you randomize, you want to, blindly randomize.
So it was random.
Have milder. This was not randomized. You would want a randomized trial to be able to do that. There have been studies that have looked at this as a prophylactic medication, meaning giving it to totally healthy people like healthcare workers and seeing if they're less likely to get the infection. And then it's gone all the way to people who are critically ill on ventilators to see if it's likely to take them off the ventilator, make it easier for them to come off. So far, you've had some data going in both directions, but lately the larger studies, all small still, but the more recent studies, right, I should say, have not been very compelling.